That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, welcome back to another episode of Real Health with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandi is my other half. She's mine.
Nobody else can have her. That is also true.
But she's the reason you probably watch the show. So thanks for joining us, and thank you for all the support we've gotten. Believe it or not, this is episode number 49.
Very exciting.
Yeah.
That means we're very close to 52.
That's right, which makes a year. Awesome. Did you work out today?
I have not worked out yet today.
You plan to?
I'm hoping to.
Nice.
Hoping is not a very secure word.
Yeah, exactly. It's like I'm going to try.
That's right. Yes.
So, but I did work out, and but we're gonna talk about testosterone, how to increase testosterone in one of our videos later today.
Yay.
So look for that one if you watch other videos on the YouTube channel.
Yes.
But
it's
Real
not
Health,
a part of the podcast.
right? It's not part of the podcast. That's not what we're going to talk about today. But it's amazing how managing your hormone levels makes a big difference in just overall life and health and mood and all of that.
Oh yeah,
so I'm
makes
feeling
a huge
strong
difference.
today.
Good.
I'll probably talk faster than normal. But Real Health Podcast is where we take the latest news in mainstream media regarding health and wellness. We'll read it, summarize it, and then talk about it and tell you what it means to you and how you should apply it to your life. But also we're going to put our natural, drugless wellness perspective to it, which is what we've been doing for the last 24 years of being in business at a fairly large now chiropractic practice. So having said that, why don't we start with the articles we promised you we would talk about today because we didn't have time to do them on the last podcast. And the first one is from Everyday Health, and the title is Acid Reflux Drugs May Heighten the Risk of Migraine Attacks and Severe Headaches.
You know, it's sad. We already knew, and we talked to patients a lot about being super cautious about the acid reflux drugs because some of even the over-the-counter, they have additional products in it that actually re-exacerbate the acid reflux as it is. So it's kind of funny. They're like, take this and get more calcium, but that also causes more acid reflux. So you do have to be wary about what's on the market.
Right.
And clearly there are some other reasons for that too.
Yeah, that's right. If there's calcium in it, it typically causes a rebound effect where you produce more acid the next time.
Mm-hmm.
And that's why people have to pop them all the time. They keep them in their pocket and they constantly take them. It's almost like an addiction. So really be careful with acid reflux. And then there's the home remedy regarding apple cider vinegar. Mm-hmm. And we actually have an article.
I know, how
entitled,
convenient.
Is apple cider vinegar hype or is it real or something like that? So we'll talk about that. Obviously, mainstream media likes medication and drugs, so they downplay anything that's natural. They downplay anything that's holistic and so on.
Right.
But coming back to this article, it says a new study also suggests that these medications may be overprescribed and people may want to reevaluate their use with their doctor.
I will 100% agree with that. I think most things are overprescribed.
Yeah,
but that's me.
I'm just glad they said it. Just like the antibiotics article we did last time, antibiotics are overprescribed. Research has shown that people who live with migraine are also more likely to have gastrointestinal problems. Conversely, those who have issues like acid reflux and GERD, diarrhea, constipation, and nausea tend to get more chronic, disabling headaches.
Yes. I find this interesting, and I want to know if, they say research has shown that people who live with migraines are also more likely to have the gastrointestinal problems. Is that because of the medication that they're taking? Because we know that a lot of those medications, the side effects, it affects the gut dramatically.
Well, the article downplays that, but it does mention it. So it says, because of this gut-brain relationship, you might think that treatment to ease gut disorders could possibly help with migraines. A new study, however, suggests the opposite. The medications used to soothe the digestive tract may increase the likelihood of having migraine attacks. So this is a quotation. It says, we had heard some anecdotal stories about patients with migraine symptoms improved when they discontinued their acid suppressing drugs, says study author Margaret Slavin, PhD, RDN, an associate professor with an expertise in migraine, food, and nutrition at the University of Maryland in College Park. Our study showed an association between their use and the risk of someone having migraine. In a study published April 24th, 2024, in the journal Neurology Clinical Practice, Dr. Slavin and colleagues reviewed data on about 12,000 U.S. adults who had provided information about their use of heartburn drugs and whether they had a migraine attack or severe headache in the past 3 months. The analysis revealed that those who used proton pump inhibitors to treat chronic heartburn were 70% more likely to experience migraine attacks or severe headaches compared with those who did not use these medications. And if you're wondering what proton pump inhibitors are, they would be things like Prilosec, Prevacid, and Nexium. Headache risk was also 40% higher among those using H2 blockers or H2 blocker drugs, and 30% higher among those taking common antacids such as Tums or Alka-Seltzer. So H2 blockers are Prevacid and Zantac.
Okay.
Now, I believe
Pepsid AC, I think it is.
I'm sorry, yeah, Pepsid AC. Sorry, Prevacid was the proton pump.
Correct.
Pepsid AC and Zantac are the H2 blockers, and I
So
believe
that's the histamine blocker.
Yes. Histamine receptor blocker, but it's not an allergy medication because allergy medication, those antihistamines block the H1 receptor. This
Interesting.
blocks the H2 receptor. And so I believe all 5 of these drugs used to be prescription drugs, and now I believe all 5 are over-the-counter
That's crazy.
medications. So there was a reason they were originally prescription only. Described in the study as the most effective and frequently used type of acid reflux medication, proton pump inhibitors, sometimes called PPIs, are medicines that work by decreasing the amount of stomach acid made by glands in the stomach lining. They include, I already mentioned, Prevacid, Prilosec, one is called Protonix, and Acifex, and Nexium. Now, keep in mind, why does the stomach produce acid? To digest food.
Correct.
So when you stop the production of acid, what happens? You don't digest food properly.
Correct.
Headaches are listed as a common side effect with PPIs, and past research has found that as many as 40% of people with chronic headaches and migraine who have tried these drugs discontinue them because they lead to even more headaches. And I think that there's other problems. There's a big prevalence of osteoporosis.
Correct.
Osteoporosis a lot of times is because we're not absorbing our food properly.
Yeah.
And some experts say, and don't quote me on this, but this is hearsay. This is me talking to other experts, researchers, and so on. But they say that the biggest deficiency in America today is not vitamin D.
Calcium.
It's not calcium. It's stomach acid.
Oh, interesting.
Most of us have too little stomach acid. Now, here's what I know about acid reflux. Keep in mind, I am not a gastrointestinal specialist. I'm not a gastroenterologist. I am not a medical doctor. I'm a chiropractor. So what I've read and studied, this is what I know. And I say this with certainty. You do the research yourself, is that most acid reflux, if you experience the burning an hour or an hour and a half after you eat, it's not because you have too much acid. It's because you have too little acid. Your stomach should be empty 90 minutes after you eat. Most people get heartburn 90 minutes later. That's not acid reflux, that's indigestion. It means you did not digest your food. Food sat in your stomach, it fermented. The sphincter above your stomach that holds the food in the stomach gets tired after an hour and a half. After 90 minutes, it starts to relax. If there's still food in your stomach, now it can splash up into the esophagus. That's when you get that burning sensation.
But I think what happens is we don't always go that far in our discussions with patients. Not us, meaning,
Your primary care
primary
doctor.
care. Prior research actually suggests that the medications that we were just talking about in the article may be overprescribed, which we agree with, and long-term use has been associated, not might be, but has been associated with a higher risk of infection, bone fractures, nutrient malabsorption, and dementia. So I think it's probably a good idea to begin reevaluating if these are medications that you've been on, either prescription or over the counter. It's probably time to start evaluating that and
Yeah.
doing a little bit more research.
Yeah, we actually give people acid for acid reflux. Obviously, part of the history is now. How many of you who have acid reflux who went to your doctor? You said I'm experiencing burning here, and they just gave you medication. They never asked this one question: do you get the acid reflux when you're hungry, right after you eat, or 90 minutes later?
Right.
They don't ask the question
Right.
because those are three different things. They should all be treated differently.
Correct. Which is probably why, depending on if you've used things like apple cider vinegar, depending on why you used it or when you experienced that will determine whether or not it works, because there are situations where apple cider vinegar we've found has been very, very helpful. And there are other times, depending on when that hits, that it's not.
Yeah. Yeah, it says many people get on these drugs, and you didn't read this already, right?
Nope.
Many people get on these drugs and stay on these drugs for too long. It says this is Dr. Montieth, a medical doctor, chief of the headache division at the University of Miami's Miller School of Medicine, and a fellow of the American Academy of Neurology. He said these drugs are helpful, but may not take the place of lifestyle interventions for common conditions such as GERD, esophageal reflux disease, and gastritis, inflammation of the stomach lining. Gastritis can be painful, guys.
Yeah. I mean, most people don't realize that digestion actually begins in the mouth. It doesn't begin
Correct.
in, further down in the digestive tract. It actually begins there.
Saliva actually has amylase in it, which starts to break down sugars.
And there are certain foods that you can take, you can eat and include that actually have that naturally in it, which can help to help with the digestion. I believe, is pineapple one of those foods?
Pineapple has bromelain in it,
Bromelain, that's what it was.
which is a digestive enzyme, absolutely.
Yeah, but
Which is interesting because I've started eating pineapple with my meals.
Yeah.
Based on the recommendation of my new bodybuilding coach, and Tommy, if you're watching, hello. When I went from 5 meals a day to 7 meals a day, I started having acid reflux.
Interesting.
And now I'm back to 5 meals a day, and the acid reflux is gone, but I've also added pineapple to my diet.
So I wonder.
Now I do take digestive enzymes as a supplement with my meals.
Right.
So anyway, something to think about. But it says the findings showed that other class of acid suppressing medications also may be implicated in migraine and severe headaches. H2 blockers, also called H2 receptor antagonist, reduce the production of histamine, which actually is not accurate, because if you're telling me you're blocking the receptor, then you're not blocking the production of histamine. You're blocking the receptor that the histamine hits. Very wrong information here. It says it's a chemical that is a key driver of acid secretion in the stomach. Popular H2 blockers include Tagamet and Pepsid AC and Zantac 360. So, guys, just be careful. The analysis concluded that the results point to potential clinical implications for any acid suppression therapy. So listen, eat smaller meals. You'll have less acid reflux. Make sure you allow enough time for digestion. If you're going to eat something sweet, eat it right after your meal, because sweets increase, because that activates digestion in the tongue, on the tongue. Sweets right after a meal, especially a big meal, help you digest faster. Bitters before your meal increase gastric juices and get you to digest faster. So something with bitters in it is
it's
powerful.
So funny how that historically was something that was a part of meals. Like, people knew this stuff.
Yeah.
They knew how important things like bitters were. We are so far removed from understanding how our digestive tract works and what's healthy and what's not healthy. And I think a lot of that is how many processed foods we're eating, how, the pharmaceuticals that we're putting into our body. I don't think most people experience normal digestion. We just don't know what
That's
it
very
looks like.
sad.
There's a lot of people who, sorry, we're going to start talking about the other end. There's a lot of people who don't even experience a bowel movement every day,
Yeah.
where honestly, you're supposed to experience them multiple times a day.
Medicine says up to once a week is normal.
Oh my gosh, not normal, people. If you're not going to the bathroom at least once a day, if not more, there's actually a problem in your digestive tract 100%.
Yeah.
You probably don't have enough fiber in your diet.
I had a patient the other day say, ever since you put me on these supplements and I started getting chiropractic care, I feel like I have to have a bowel movement after I eat every time I eat. And I think that's abnormal. And I said, no, you're finally normal. There is actually a reflex that's built in us, just like, when you tap a tendon and your foot jumps, there's a reflex. Is that when you eat, things start to move. Actually, what comes out is what you ate 2 days ago.
Right. It's the byproduct. It's what's left over.
It's not what you're eating right now that comes out. So anyways.
I'm really glad that we actually have a family doctor that knows this.
Yeah.
And actually, I think I really began to learn about how things were supposed to work when our kids were little, because she'd be like, okay, how many bowel movements a day are they having? I'm like, huh? How many are we supposed to be having? She goes, well, how many times are you eating? So, early on, that's something that was put into.
Right. Now, don't think if you only have one bowel movement a day, you're abnormal. That's fine. You're okay.
Yes.
The reflex is still there. You're still okay. But if you're having less than one a day, then we need to see what's going on. Some of that is neurologic, which means your body may be stuck in fight or flight. You're too stressed. You're too worried. You're too nervous. You're too angry. And bowel movements don't work in an angry person.
So there could be lots of reasons.
Yeah.
But
so the article said, how might medication affect headaches and migraine attacks? And the answer was they're not sure. So I'm not going to read that whole thing. Reassessing but not necessarily discontinuing medication is the title here. There's the Dr. Targonik, medical doctor, said there's no obvious biological reason why a drug that primarily inhibits the production of gastric acid would affect one's likelihood of developing migraines. So it is unlikely that there is a direct causal link between PPI use and the occurrence of migraine, she says. She adds that findings such as these have the potential to promote the inappropriate discontinuation of PPI use. Of course, mainstream media's funding comes from drug advertising. 70% of all media is funded by drug ads. And so they cannot say anything other than this. And that's why they have this doctor, I can't pronounce her name. And
just because there's no obvious biological reason does not mean that there's not a reason. It just means that when they're looking at it surfacely, it's not there in lights and neon sign for them going, this is the obvious reason, right? It doesn't mean that it doesn't exist. It means that they haven't looked deep enough yet. And they're not willing to, perhaps because we don't want to offend the people that are paying for us to put stuff out in the media.
Which is why, I've seen more and more people just get their information from sources like this. We're not funded by anybody. So we're not under any obligation to promote one product over another. There's no one paying us to say anything. And in fact, we do this for free. And the reason we do this is because we do it anyways.
Yeah.
This is what we do. We take care of people. Our patients want us to know what's the latest information. So we read this stuff anyways. So last year we said, hey, if we're doing this anyways, we're reading the articles, we're discussing it, but let's do it on camera and so others can benefit from it.
Absolutely.
So that's why we do this. And hopefully it's something you value. Maybe you'll share it with some friends and so on. So another article we promised we would talk about is expiration dates.
I was actually kind of excited about this because I am really anal about expiration dates.
We found some coffee in our cupboard. It was decaf coffee grinds that expired 4 years ago.
Yep.
And I said, it's fine. Just brew it because we wanted to drink coffee, but it was nighttime. We didn't want any caffeine, so we're like, it's fine, just brew it. And she threw it away
I
because she
did
said,
not
"There's
brew it.
no way this thing expired 4 years ago." And I said, "I don't think coffee expires, especially that thing was sealed in a very special packaging.
I
It
know.
wasn't like in a jar
But it
that had
has
been
a
opened."
little hole that you can squeeze and air comes out. Like you can actually smell the coffee. So I'm telling you, it is not vacuum sealed. There is, if you can get something out, you can get something in.
Hmm.
So I struggled with that a little
let's
bit.
see what the article says.
Well, and also remember, I also purchase a lot of things organic. And when we're talking about things and how they
Well, they don't
spoil,
have preservatives in them, so they
correct, it's
spoil
vastly
better.
different. So,
It's
and
true.
I have tasted things that have expired
Yeah.
and have gone rancid. Not enjoyable, very hard. I can taste it right now.
I mean, my thought process was we don't have any other decaf. Let's brew it, and if it doesn't smell right and taste right, then we won't drink it. But if it does, then it's probably fine, as long as you don't see bugs crawling around in it.
Ugh, see, again, EPGBs. Here's what I did love about this article. I learned a new word. Usually you're the one that is like, that can't possibly be a new word or a word, period. And here's a word, fusty.
Yeah.
Did you know that
What does
was
it
an
mean?
actual word? It
No.
means smelly, musty, damp, or stuffy. I think they just took all of those words and made a new word called fusty,
Who knows?
which is kind of fun.
It is the New York Times,
Well,
and New York Times. They are self-proclaimed experts at everything.
yes.
And I found that reading a lot of New York Times articles. So from the New York Times, it says the food expiration dates you should actually follow. The first thing you should know, the dates as we know them have nothing to do with safety.
Are you kidding me? The FDA is doing something that is not about safety. Are you kidding? This is news to me. This is like the first time we've ever read an article where the FDA is not concerned about safety. This is mind blowing. That was sarcasm in case we needed to know.
Yeah. Right. Right. Now, if it said it has everything to do with money, that would be accurate.
Amen.
Here's the first thing you should know. Expiration dates are not expiration dates. Food product dating, as the U.S. Department of Agriculture calls it, is completely voluntary for all products, with the exception of baby food. More on that later. It has nothing to do with safety. It acts solely as the manufacturer's best guess as to when its product will no longer be at peak quality, whatever that means. Food manufacturers also tend to be rather conservative with those dates, knowing that not all of us keep our pantries dark and open our refrigerators as minimally as necessary. Let's start with the things you definitely don't have to worry about: vinegars, honey, vanilla or other extracts. Sugar, salt, corn syrup, and molasses will last virtually forever, with little change in quality. Regular steel cut or rolled oats will last for a year or so before they start to go rancid, but par cooked oats or instant oats can last nearly forever.
All of those oats I threw away.
Same with grits versus instant grits. All right, now flour. White flour is almost certainly fine to use no matter its age. Whole wheat and other whole grain flours can acquire a metallic or soapy odor within a few months. This whiter equals longer rule of thumb is true for non-ground grains as well. Refined white rice, for example, will last for years, while brown rice will last only for months. This is because unrefined grains contain fats, and fats are the first thing to go off when it comes to dry pantry staples. Tree nuts, typically high in fat, will go rancid within a few months in the pantry. Store them in the freezer to extend that to a few years.
I've always kept our nuts in the
Is that
in
right?
the freezer. That and extra chocolate chips.
Oh, nice. So we're talking about bread next. Shelf-stable supermarket breads made with oils and preservatives can stay soft for weeks in the fridge, but the lean, crusty sourdough from the corner bakery will be stale by the next day and probably start to mold before the week is up. Beans. Dried beans and lentils will remain safe to eat for years after purchase, but they'll become tougher and take longer to cook as time goes on.
So it just says if you're not sure how old they are, just be careful using beans in recipes that have ingredients that are acidic, like lemon and things like that, because it won't break down the bean as much. So in an instant like that, you can actually soak the beans for like 24 to 48 hours before using them, and that will actually help them to cook off a little bit better and get
Nice.
softer.
Spices. We all make fun of our parents for using spices that expired in the 1980s, but other than losing potency, there's nothing criminal in using them. What about canned and jarred goods? As a rule, metal lasts longer than glass.
I would not have thought that. I would have totally thought the reverse, that glass and then
Yeah, I would have thought glass, then metal, but it says metal, then glass, then plastic.
and plastic, that's a given. We all know that breaks down very quickly and
Yep.
easily. So especially in varied temperatures. So watch out for that.
It says so long as there is no outward sign of spoilage, such as bulging or rust, or visible spoilage when you open it, such as cloudiness, moldiness, or rotten smells, your canned fruits, vegetables, and meats will remain as delicious and palatable as the day you bought them for years.
I'm so excited to hear that.
Do we get any canned foods? Metal
Yeah,
canned?
and I don't use them very often, but we do. We do have some canned beans, and I don't use canned vegetables very often. I usually go frozen if I'm getting them out of season. But it's good to know just in case.
Yep. Some of them have that button that pops up when there's bacteria in
Yeah,
them.
almost all glass will have that. So that's going to be on the lids of all of the glass jars. So oils.
Yep, oils. Oils, even even rancidity prone, unrefined oils stored in sealed cans are nearly indestructible. Oils in sealed glass bottles, less so. Oil in open containers can vary greatly in shelf life, but all will last longer if you don't keep them near or above your stovetop where heat can get to them.
Hmm.
Old oil will start to develop metallic, soapy, or in some cases, such as with canola oil, fishy smells.
It'll also get, if you just put it on your fingertip instead of it being slick, it'll actually be tacky. So that's an easy
Yeah.
way. Don't taste it.
No.
Just touch it. Touching
It
is
says
fine.
don't trust your nose. Put a drop on your fingertip and squeeze it. Rancid oil will feel tacky. Salad dressings will last for months or over a year in the fridge, especially if they come in bottles with narrow squeeze openings.
I know. I just learned last year that mayonnaise was shelf stable after it's opened.
Oh.
So they did that actually, I think during World War II, they began to change the formulation so that it would be shelf stable. It's a vinegar based. So
Yeah.
technically speaking, you are supposed to be, I'm not telling you to do it, I don't do it, but you are supposed to be able to leave mayonnaise out on the counter without it going bad,
Even after you open it.
even after you open it. So I think during those, I used to be concerned about that during, like, we would have people over and have parties or whatnot or cookouts, and I was always worried about keeping that on ice. You
Yeah.
don't have to. It can sit out during the party. No worries.
Hey, that's what it says here. I just read it. It says mustard lasts forever. Ketchup will start to turn color before the year is out, but will still remain palatable. Contrary to popular belief, mayonnaise has an exceptionally long shelf life, especially when it doesn't contain ingredients like fresh lemon juice or garlic.
Yeah.
Soy sauce has a reputation for longevity, but I keep mine in the refrigerator to fend off the fishy aromas that can start to develop after a few months in the pantry. How about eggs?
This will be eye-opening. I've met so many people over the past few years that raise chickens for eggs, and I had no idea how long you could like keep eggs on the
Yeah.
shelf, even like or on the
It
countertop.
says we all know what a rotten egg smells like, right? Why else would it be a benchmark for describing so many other bad smells? But how many times have you actually smelled one? Once, twice, never, probably never, at least according to the impromptu poll I conducted on Twitter. That's because it takes a long time for eggs to go bad. I
But
have smelled
I
rotten
have
eggs.
too. And what I would say in contrast to that, though, is that while eggs may take a long time to go bad, you can have a bad egg in a batch that has nothing to do with
Right.
how old it is. It can just be a bad egg. So I have learned, because I've hit many of those, because I do a lot of cooking and I do some baking. So I always break my eggs in a separate container. Do not break them over your main dish that you're trying to cook in. Open them separately and individually
Yeah.
into a small bowl. So if it is bad, you can toss it. You don't lose your whole kit and caboodle. So
It says several weeks. 60 days, several weeks.
well, it's saying even at the pack date, what you see on there is a pack date. And usually they don't even hit the supermarket. They're not even packed for like 30 days after they're laid.
Yeah.
So they're sitting out for 30 days at minimum before they're ever packed. And then sometimes it's another 30 days before they even make it into the supermarkets. So there you go.
So milk is next. How does it go bad overnight? The truth is, it doesn't. From the moment you open a carton of milk, bacteria start to digest lactose, which is milk sugars, and produce acidic byproducts. Once its pH hits 4.6, that's when casein, which is milk protein, clumps. Want longer lasting milk? Look for ultra high temperature or UHT on the label. Milk in these cartons has been pasteurized at high temperatures, 275 degrees Fahrenheit, hot enough to destroy not only viruses and bacteria, but bacterial spores as well, then aseptically pumped and sealed into cartons. Most organic milk brands undergo UHT. In the blind taste tests I've conducted, most people preferred the sweeter flavor of UHT milk. The heat does release more of the sugars, but it denatures the protein.
Right.
So I don't know. There are some nutrition experts who say low temperature is better milk, higher quality milk, more nutritious, blah, blah. Baby food.
Anything ultra processed is never going to be
That's true.
healthier, right? I
That's
mean, we
true.
know that from our, extra processed white flours and grains and things like
Yeah.
that. Anything that's bleached and whatnot, it's never going to be as healthy. So that's, I think, pretty much a given.
Last one is baby food. And as for baby food, the only food with federally mandated use by dating that expiration date represents the latest date that the manufacturer can guarantee that the food contains not less of each nutrient than what is printed on the label. Or, in the case of formula, that it can still pass through an ordinary rubber nipple. Rest assured that if there's a zombie apocalypse, you'll still be able to eat the baby food
Thank goodness.
and gain some nutritional benefit.
Thank goodness. I was most concerned about that.
The zombie apocalypse?
Yes.
Well, I think we have time for one more article. I want to pick a short one. Certainly not the apple cider vinegar one. Let's do this one really quick because we talked about mammograms in a previous podcast recently. So this article is from Everyday Health. It says women should start getting mammograms at age 40, not 50. Women at average risk for breast cancer should get mammograms from age 40 until age 74 per updated U.S. guidelines. The latest guidelines also recommend mammograms every other year, even though many experts say annual screenings are better. Really interesting. Women with a family history of breast cancer or other genetic risk factors may need to begin screening at an earlier age, earlier than 40. So they're changing the guideline from 50 to 40, meaning start at 40 years old, not 50. But then they're saying only get them every other year.
Right. And part of that is so first we should know that the gold standard used to be that you would start at 50 unless there was a family history or another risk factor. At that point, it was like for me, they told me because my mother was diagnosed at 24 with breast cancer, 5 years earlier is when you should start your screening. So at 19 is what they recommended. So now there's a new task force that have been given the job to figure out if we're really doing what we should be doing. So they said, let's start it 10 years earlier because people are getting cancer much earlier. So let's try to detect it earlier. But now we're saying we're going to put women and give them more radiation because that's what happens when you go in for a mammogram. It's more radiation. And there's a risk factor to that. So in order to mitigate that risk factor, they are saying, let's start it earlier, but let's then go every 2 years. More alarming to me was that we go, well, once you hit 74, we don't care anymore. I don't
Listen,
understand.
when it's a government mandate, you know why they do that.
It's all money.
Population control.
That too. That's crazy.
They think if we live longer, we're going to be a burden financially on the government. The fact is, if we live longer, we're more productive, more effective, and more profitable. It's my opinion.
But I'm like, we need to put way more value in our senior population than what we do. That is where our information, our history, our data, our experiences come from. We need to start caring a little bit more there. I'm telling you.
I agree.
It's going to create massive
We got an article
problems.
about superagers that we're going to do in one of these articles. But it says by starting at age 40, we save nearly 20% more lives from breast cancer overall.
And we don't know how many we're going to lose by now saying every 2 years for the rest of the population, right?
Well, that's why everyone should do self-exams.
Yeah, and I'm not a huge proponent of mammograms anyway.
Yeah.
I think that they can be okay for some preventative, but we also know that you can't see a mass at a certain size on mammograms, so you're going to miss some anyway. We've talked before about thermography. Look into that. Thermography is a fantastic way to for certain types of cancer, skin cancer, breast cancer, to be able to detect changes in temperature, blood flow, things like that, which would give you an earlier reason to look at those areas and to begin doing some earlier testing. Mammograms do come with a risk. And so an increased number of mammograms, you're increasing your risk of cancer as well. So I don't know. While I do not agree with some of their reasoning and what they're saying, I'm also not a big proponent of.
This was interesting. It says mammograms have helped reduce breast cancer deaths in the United States by close to 40% since 1990, according to the American College of Radiology. So I'm glad we've reduced death by 40%.
Sure.
But why is it only 40%?
Right.
Why isn't it more? Like clearly we're not catching it all.
It has to be the early detection, right? So, and again, if there's certain types that you're not going to catch
till later, because remember we talked about women with dense breasts, and they really should have ultrasound and MRI.
Or MRI,
Mammogram is not going to show
correct
cancer
and there's a large number of women who have the dense.
This article said nearly 1 in 2 women over 40 have dense breasts, which is a risk factor for breast cancer. But it also means that the mammograms won't be able to show cancer. But now the task force that came up with these guidelines, it says, however, the task force concluded that more evidence is needed to make recommendations for supplemental screening regarding dense breasts.
Yeah, but they're only going to say that because they don't want to spend the money on it right now.
That's what it said. The next paragraph talks about insurance companies.
Right.
Because they're the ones who have to pay for it.
Correct.
And they're refusing. So because their guidelines is going to determine whether the insurance company is going to pay for it or not. So why won't they set that guideline? It's not coming out of their pocket. It's coming out of the insurance companies, unless they're in cahoots with each other. Unless the insurance company is paying them, say, hey, don't say this and say this, and we'll give you more money because we're going to save more money in the long run.
Yeah.
Otherwise, what is their incentive to say, no, we're not sure if you need supplemental screening?
Right.
It's shameful.
It is.
It's disgusting. They're playing with people's lives.
They are.
Anyways, I don't trust them. I don't trust insurance companies because they're worried about saving money and not the health and welfare of people. And I don't trust some of these committees if they're saying, oh, we're not sure. What does that mean, we're not sure?
Right.
I mean, there's so much evidence.
Right.
Every article talks about dense breasts are more susceptible and mammograms won't pick up cancer. Do this other screening.
And then they say, but there's not enough evidence for us to really say. I'm like,
what more
there
evidence
is.
do you
We
need?
just, that's the same disclaimer that insurance company use to say, they go, these are the benefits, but we reserve the right to deny this claim based on really whatever we choose to.
Yeah.
So they can choose to deny
Right.
whatever they want, even though it's a given benefit. So
Telling you,
that's how they make money.
We're making friends with all insurance companies on this
They love
podcast
us.
and FDA too. We're really, really making
I
friends with
feel
the
the love
FDA.
right now.
Oh my goodness. Anyways, trust no one.
Do your own research.
That was a line in a Sylvester Stallone movie.
Oh, okay. I believe that. Sounds
DTA,
right.
don't trust anyone, is what he says. He goes, DTA, don't trust anyone. There's a prison movie. I forget the name of it. Lockup. It was the movie Lockup.
There you go.
And they told all the new inmates, don't trust anybody. Anyways, don't trust the FDA. I can say that with certainty. Listen, guys, good show. I think we covered a few good things.
I think so.
You know, regarding deadlines on food and acid reflux, headaches, and medication that causes that. If you can do it without meds, do it without meds. You're safer. You're better off. Side effects, overprescription, all that stuff.
Remember, digestion begins in the mouth.
I got a good one for next podcast. I want to start with this next time. It's about a little boy, 4 years old. He had cardiac arrest. His heart stopped for 19 hours. You'll want to tune in and listen to his story. Anyways, God bless you. Thank you so much for watching and listening and being part of our online family. Comment, please. Let us know what you think. Let us know what you want us to talk about. There's so many articles we throw away because we just don't have time to go over all of them. We still read them, but we want to bring you the most important ones. So take care, and we'll talk to you next time.
See you then.